Okay, we're going to demonstrate how to treat back pain. We're going to begin by scanning the area with HG8. We're going to do that with a sweeping motion, just straight up the back, coming out in different directions to try to pick up any adhesions that built up. And come back in the opposite direction as well. And back up. Check the rhomboids and the lower trap. Again, you want to make sure that you're not running over the spinous processes. And be careful when you're running over the ribs as well. Once you identify any adhesions, we found a few here, a few up here. We're going to go back and desensitize the area with HG7. So just go over the area, a sweeping motion, as well as fanning. And push it all the way up through the kinetic chain. Once the area is desensitized, we can go back in with a convex instrument, again HG8, and get a little bit deeper in to break up the adhesions using a fanning motion. And as you can see, petechiae is already beginning to develop in this area here. That's when we're going to want to start to move on to the other areas. Again, no more than 30 seconds to a minute and a half per site. And always come back in opposite directions. So it seems that we isolated another area of restriction in this area. So we're going to go back with HG9, a more precise instrument, and try to strum through the musculature in this area. Again, coming in opposite directions. And then once that starts to erupt a little bit with petechiae, we're going to finish with HG2. Sometimes it's easier with this instrument to have the patient get up on both knees and just lean forward. And that really accentuates the curve here, and then push HG2 through the paraspinal muscles and along the shoulder, through the whole kinetic chain. Okay. Now when treating the paraspinal muscles directly next to the spinous processes, we're going to want to use HG9, and we're going to want to use a J stroke. First, you want to identify the spinous processes with your other hand and just mark them so that you don't bump into them during the treatment. Take HG9, push straight up, and then J out. And just follow the spinous processes all the way up in that fashion. And then you come back in the opposite direction, again marking the spinous processes coming down and out.